This is Jackie, your family midwife, once more. So today I want to analyze who can use family planning. Remember, we are in our family planning series. So we want to talk about who can use family planning. So remember, we said family planning is deliberate prevention of pregnancy. So we want these people who are married, sexually active, they want to not get pregnant at the wrong time, to avoid interrupting certain sessions or certain phases of life. So who can use family planning? Number one, women of reproductive age who are sexually active. So women of reproductive age, according to the estimated age in health, is 15 to 49 years. But remember, you even use more as long as you are sexually active and not in menopause. So it can be used by all women of reproductive age. That is any woman who can conceive and is sexually active, they need to use family planning. We said the benefits of family planning. So another person who can use family planning is youths. There's a major focus on youths and adolescents. As we said, in the area of women empowerment, we want all the youths and the adolescents who have gotten married early or are sexually active. We don't want them to stop school or also to stop their career development. So there is a special focus on them, and their services are acceptable, they are equitable. These are services that are accessible and services that are also affordable. So remember, you can find something that is appropriate for you. Your medical health provider will always give you the best option for you. One factor you need to consider on youths is that methods that are permanent are not, maybe you would need to consider not using them, especially if you are planning to have children. So you want to use methods that are not very permanent, so that you don't affect your reproductive health or your reproductive health when you want to conceive. So these are youths, and remember, you'll always find people who are very friendly and ready to help. Then the other people are people with disabilities. Like in Kenya, we have around 5% of people who live with disabilities. Remember, these people have an equal right. If you have any disability, you have an equal right to family planning and having a family, siring children. So the moment we get to family planning, we also are considering anyone living with disability. And so we want these people to also be sorted out in terms of family planning. And when what you need to consider most is something convenient for you. So a method that you will be able to use comfortably with no stress, and something that you will also feel maybe your condition and the method sorry, your condition and the method just go hand in hand and are okay. So we also want to protect the people people with disabilities. You would also want to protect yourself from sexually transmitted infections to avoid any suffering related to these conditions. So another group of people that we really want to consider are women that are near menopause. So remember, there are women who have conceived, have had unwanted pregnancies when they are almost near menopause, because maybe they stop family planning earlier than they should, or maybe you confuse menopause with hormonal imbalances. So a woman near menopause is supposed to use family planning methods. Remember, you're also considering how frequent you need these methods or for how long you need them. So in simple, your method, use it, should be convenient for you, and also use the method until 12 months of no menses. So you use the method until you have had 12 consecutive months of no menses. If the menses failed for 1 month and came maybe after another month, and you just had maybe periods here and there, you still continue with family planning until the menses do not are not seen for 12 months consecutively. So this is what we look for in women near menopause. So remember to use family planning so that you do not get a surprise of old age. Okay, then another group that may need family planning is the male gender, or the men. We have family planning methods for men, and you can reflect about them. And so we will be discussing these methods each in details. So these are the groups, or the major groups, that will use family planning methods. And so be ready to get more about these methods individually, or to know which methods they are and how you use them. Thank you so much.